In the deep dive tonight, 7 News has reported for months now on problems at Cedar Hill Regional Medical Center in Southeast.
The medical center was meant to close a healthcare gap in an underserved part of the city. But as our Washington, D.C. reporter Phylicia Ashley exclusively uncovered, patients feel a promise of quick, adequate care has been broken. She's spoken with patients and former workers about their concerns over care, wait times, and staffing.
Just last month, council members questioned city and hospital leaders about whether the center was even ready to open in 2025.
I want to make sure that the decision to open that hospital was not a political one. It was not about the ribbon cutting that was driving it, but rather was the hospital ready for operations? And that people have the space to say, hey, you know what, we might need another month, or did they feel like they couldn't?
It was me that went to the CA and the mayor and said, we can open in April.
Now, Henderson also shared in a post on X that DC Health data shows Cedar Hill had the longest ambulance drop-off wait times of any DC hospital. The average wait time was 1 hour and 16 minutes back in December of 2025. Now, there is a shakeup underway in how the hospital is operating.
Phylicia joins us live now from the hospital. Phylicia, walk us through the changes that are on the way.
Right, and it all goes back to where this all started, right? Because before the hospital was even built, people voiced serious concerns about staffing. And what we learned is that we uncovered severe and dangerous staffing issues from the moment that ribbon was cut up until the start of this year. And even until now, Medical Faculty Associates, which is part of George Washington University, was responsible for some of that staffing. But what we learned is that that's all about to change. Now GW is handing over even more responsibility of the physicians, clinical services, and the costs to Universal Health Services, which operates the hospital.
I hope that it means that right there at Cedar Hill, that you have leadership that is specific for Cedar Hill, that you have the needs for the specialties and the different services right there at Cedar Hill.
I spoke to Dr. Marilyn McPherson-Corder. She is a respected physician with more than 40 years in the district. She says this change could get the hospital closer to full staffing and services. 7 News has been reporting extensively on the staffing shortages and other problems at Cedar Hill Regional Medical Center.
I feel that it being brought out in the public, that the urgency, the importance, and the outcry of the community made a big difference.
Dr. Edwin Chapman is a distinguished physician with more than 40 years of service in D.C. He says the way the hospital is set up put it in the challenged position it's in now.
We've seen these models before across the country where for-profit organizations come in and almost invariably the services go down because of the cost, because these are entities that are there to make money. And it just does not work.
When it comes to improvements with patient care, both doctors say time will tell.
We have now seen corrections, hopefully in a positive way. There have been discussions, there have been solutions, and now we want to see how that plays out in actuality in real time.
In real time, what we also know is that more changes are on the way. Since our reporting, the hospital has announced that they have opened more outpatient services. On top of that, they're now in communication with more community doctors to get them involved in this hospital. I'll send it back to you.
Phylicia, when would the change be final? And then how will any sort of changes directly impact patients, you think?
Right, great question. That's something that I looked into today. What we know is that this deal is supposed to be final by this summer. When I spoke with both of those doctors, they said Universal Health Services, which operates this hospital, it's a for-profit company. So they said this could go either way. One, they say as they read through this deal, it appears that it would allow Cedar Hill to act more independently. But they said because of how UHS operates, depending on what it prioritizes, it could either bring more resources to this hospital and to the community, or patients may just see a lot of the same. For now, reporting live from Southeast D.C., Phylicia Ashley, 7 News.
All right, some wait and see there, Phylicia. Thank you. Now, the D.C. Department of Health also issued Cedar Hill a citation of immediate jeopardy back in February. DHS says it reflects the highest level of non-compliance, and according to federal standards, it means a healthcare facility's non-compliance puts patients at serious risk of injury, harm, impairment, or even death. The city agency says it found deficiencies in surgical scheduling. The hospital has to make several changes now in order to come back into compliance, including completing documentation in real time. And you can find more of our extensive coverage on Cedar Hill, on WJLA.com, and on our 7 News YouTube channel.